MMT, hip extension, gluteus maximus and hamstrings. Assist the patient to the prone position. The arms may be overhead or abducted to hold the sides of the table. Stand at the same side of the leg being tested at the level of the pelvis. Passively move the patient's hip through extension while maintaining knee extension. You are not assessing the infield. You are determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to extend the hip as you observe for any substitutions. Stabilize the patient by placing your arm across the pelvis. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include flexing at the knee and the pelvis coming up off the table on the side being tested. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient by placing your arm across the pelvis. Place your hand of your other arm across the posterior leg just above the ankle to apply the force using a long lever. The force at the distal ankle should be directed downward toward the floor. Apply the force for a 5-second count. Grade 5, normal. The hip extended with the knee straight to the available range of motion, and the patient was able to hold against maximal resistance with no break in the position. If this condition is not met, you must change the application of force. The hand applying the force is now placed on the posterior thigh, just proximal to the knee, to use a short lever. Again, the force is applied downward toward the floor. Grade 4, good. Hip extended with the knee straight to the available range of motion, and the patient was able to hold against maximal resistance with no break in the position. Grade 3, fair. The patient is able to move through all the available range of motion and hip extension with knee extension, but is unable to tolerate any resistance. If none of these conditions are met, we must reposition the patient into a gravity-eliminated position. Assist the patient into side lying with the test limb on top. The lower leg can be flexed for stability. The gravity-eliminated position of the therapist is to stand behind the limb being tested. Support the test limb under the knee and make sure the knee is maintained in extension. Place your hand on the pelvis to stabilize against extraneous pelvic motions. Ask the patient to extend the hip while maintaining the knee in extension. Grade 2, poor. The patient completes full hip extension range of motion in the side-lying position. If this condition is not met, then you must reposition the patient to test for a grade 1 or 0. Position the patient prone as you did initially. Stand at the side of the limb being tested, level with the hips. Palpate the hamstrings at the ischial tuberosity. Palpate the gluteus maximus with deep finger pressure over the center of the buttock and over the upper and lower fibers. Ask the patient to attempt to extend the hip or to squeeze the buttocks together. Grade 1, trace. There is partial range of motion, or you are able to palpate a contraction of either the hamstrings or the gluteus maximus. Grade 0, no palpable contraction.